Hi, my name is Chikodi. Today I'm going to be talking about something very, very important. And this might be a tough pill for some of you to swallow. But did you know that some nurses and doctors actually don't like taking medicines? Well, at least the ones I've been around. And as someone who's around nurses and doctors, I can tell you that many nurses and doctors, we believe in medicine, but for whatever reasons, many of them don't just like taking medicine. So that begs the question, are these nurses and doctors hypocrites for not practicing what they preach? For one, I don't think it's for anyone to judge these nurses and doctors, as everyone has the right to decide what goes into their bodies. For instance, the same thing happens in other industries. I've heard of people who work in the meat industry who stopped eating meat after becoming aware of the gruesome process of producing meat. However, these people still continue to work in the meat industry, only that they stopped eating meat. Or how about the winemaker or the bartender who doesn't drink alcohol for whatever reason but still sells alcohol to others for a living? Are these people too hypocrites? So then the question remains, why then do some nurses and doctors hate taking medicine? Is it because they know too much about these medicines that they're offering their patients? For one, I think many nurses and doctors know from studying how medicines work that many medications have side effects, and unfortunately, these side effects can be serious and long lasting. Another reason I think nurses and doctors are hesitant to take medicine is because they know from personal experience that some medicines are addictive. Many doctors and nurses have seen what medication addiction have done to their patients or even family members or even co-workers, and as a result are very cautious of taking any drugs that has a potential for addiction. To illustrate, I remember reading stories of two nurses who for whatever reason started taking pain pills, became addicted to these pain pills, and unfortunately these two nurses overdosed on these pain pills and died. So yes, stories like this can be a reason for a nurse or a doctor to be very hesitant to take medicine, especially the medicines that are addictive. And for patients, what I'm going to say to you is this: become knowledgeable of the medicines you are taking. Educate yourself on the potential side effects of your medicines, and you must be your own advocate when it comes to working with your doctor to find the right medicine for your condition. I can't say this enough. You must educate yourself and be your own advocate. On a personal level, on a personal experience, I remember when I had a surgery in a hospital. I remember how my doctor was so willing to prescribe strong pain pill that has a potential for addiction. And with me being in the medical field and knowing the additional risk of the medicine that my doctor wanted to order, I immediately said no way. Rather, I asked the doctor to order something that had a low risk for addiction, and she did. Again, the reason I was able to make this decision and advocate for myself was because I didn't want to take a risk on any medicine that I could get addicted to. And this is not to say that everyone who gets started on pain pills become addicts. However, the reality is that some patients become addicts, and unfortunately, these addictions tend to destroy their lives. Some of these patients who get addicted lose their jobs, become homeless, and unfortunately, some will lose their lives due to overdose. I know this as a fact because I take care of patients with prescription drug addiction. So you ask them, if doctors and nurses know some of these medicines are so addictive, why then are they still giving them to their patients? Well, the same question goes to the winemaker or the bartender that knows alcohol is addictive but still sells wine or alcohol to people. And I think the answer is very simple. Medicines and alcohol are not inherently bad. They only become bad when they turn into addiction. Thank you for listening.